The virus outbreak. The president's top health officials have put out a list of pharma companies that put a vaccine into production by the end of the summer. On that list, Moderna and Johnson & Johnson, among others. Marc Siegel, Dr. Siegel, is with us now. All right, Doctor, what does this mean? Will we actually see a vaccine by late summer, late September, that actually works and has been tested? In your opinion, will we see it?
Yes, Stuart, I think the science is really there. You mentioned Moderna. They're showing a robust immune response. We're seeing that with the BioNTech Pfizer vaccine. Both of those are brand new genetic technology. Johnson & Johnson is using a vector, meaning a different virus, to carry the protein to trigger the immune response. But the story today that's really important is that basically the rubber is meeting the road, meaning manufacturing is already gearing up before we know which vaccine it's going to be. 300 million doses are anticipated by the beginning of next year. They're starting to look for manufacturing sites where to make the vaccine. They're putting together the raw materials for the vaccine. All of the basic stuff that usually gets delayed is now being put into place with billions of dollars. In the end, when they figure out which candidate emerges, they're already going to be ready to gear up and produce 100 million doses out of the chute. Amazing, never been done.
Okay, now deal with this one, Doctor. Dr. Fauci says we're seeing this surge in new cases because we didn't lock down completely. What do you say about that?
I have a different view, and I talked to Dr. Fauci about this last week, Stuart. I think it has to do with what the phases of reopening were. Why did we reopen bars? Why indoor restaurants? Why movie theaters and gyms and their hair salons in some places? It's what we reopened that allowed younger people to congregate together and spread COVID-19 in hotspots. It's not a matter of throwing a rope around Montana or South Dakota and closing down the whole country, destroying the economy and everybody's mental and physical health. It's a matter of having the right targets and shooting the right weapons at them. Yes, we needed certain surgical laser shutdowns that were relieved too soon. That I believe, but not across the board.
Okay, we hear you, Doctor.
And not schools either.
Okay, we understand. Doctor, thanks very much for being with us. Good stuff today. Thank you.